Let's go.
Freedom. Freedom.
I wanted to do people that my hair is really growing, y'all, with that rice water and my vitamins. I wanted to do people that deal with iPhones, have annoying things that happen to them, like I do with these fucking Androids. Every time I try to start this camera, that damn Bixby bitch is always interrupting me and popping up. And that's another thing I hate about these damn technologies, how it make you do shit that you don't want to do. Like, you don't want to turn on certain shit. It keep trying to pop up. Then you try to figure out how to turn the shit off. So fucking annoying, y'all. That's how I can honestly say right now, I miss when life was simpler, you know? Okay? In a sense of that. This whole technology shit is so fucking annoying. So, what I want to talk about today is I got my blood test results back. Today is now November the 18th, 2023, Saturday, 7 o'clock p.m. I got my blood test results back. I just got through eating so I can take this medicine. And I have yet to touch bases with my let me get my chart out that I'm keeping track of the medicines I'm taking. I haven't touched bases yet with my rheumatologist, because I just got all this information as of Friday, which was yesterday, from the Quest Diagnostics. Don't y'all hate that when meat getting your teeth? I do. It's annoying as hell. Let me get my results. So, I got my results back on, that's not the damn file. I got my results back on, what's the date? I got my results. I did my test. I went to go get the labs done November the 9th, 2023. And I just received them, what was that, yesterday? Which was the 17th. Yeah. And it was actually reported November 15th. So it's all, you know, everything's falling right on time. So I am borderline diabetic. I'm sure that has a lot to do with my eating habits, hereditary eating habits. You know, how black people are, you know, raised up with their diets, and then it being a hereditary thing. So it's borderline diabetic. My fasting sugar was 108 the morning I had this done. And here's where the unveiling of what I already knew my body was telling me, that this is deeper than just Sjogren's. And what I loved about Dr. Mihu is that she stated that. She said Sjogren's is basically like asymptomatic to a bigger issue. So it's like having, you know, the flu And so now you have a horrible congestion. Or you have conjunctivitis where your eyes are gooey and red and, if irritated. Or sinusitis, right? So that's what Sjogren's is like. The cousin, a relative to a bigger root autoimmune disease. So then everything was looking, and I'm grateful that Dr. Mihu did suggest that we go through Quest and not LabCorp, because they are way better with the way they even do their printout. Me being a patient can clearly understand their reference ranges over here to the right, and then in green means that you're good. Everything in red is what we need to pay attention to. So now my SED rate is called, the way it says it here, SED rate by modified Westergren. SED rate by modified Westergren was 22. So it is very high. So what is the SED rate by modified Westergren? Let's talk about it. Now, I know that my rheumatologist has to give me the official diagnosis, but I am clearly seeing it right here because it's written here in the lab report, what the diagnosis is based on lab work. Okay? So this, when I said I love how everything went with the visit, her energy had, really soothing, bedside manner. I felt like she asked pertinent questions to show me that she really do care on a deeper level than to just write prescriptions, and send you on your way, and call next for the, like it's just numbers. Patients are just numbers. That's not the vibe that she gave me. That's what I was saying that I loved about my visit with her. Okay. So, and she asked me about vitamins and things like that. So it says here, okay, where was it that I was reading at? Is it here? Yes, I got it. Just got through eating some corn on the cob. It says ESR stands for erythrocyte sedimentation rate. It is commonly called a SED rate. It is a test that indirectly measures the level of certain proteins in your blood. This measurement correlates with the amount of inflammation that's in the body. Okay? It says blood is drawn from a vein, usually from the inside of the elbow or the back of the hand. A needle is inserted into the vein and the blood is collected in an airtight vial or a syringe. Preparation may vary depending on the specific test. And what Dr. Mihu was saying, the specific labs. Okay? And I also read that certain labs do it a different way. So I don't understand how Harris Health Systems lab partnering with LabCorp, because they did send some of the work out third party, and it's so convoluted. Okay? So basically, she took blood. It's telling you how to prepare for the test. Okay? And so here's the part that's important even more so. Why the test is performed. Reasons why a SED rate may be done include unexplained fevers, certain types of joint pain or arthritis, muscle symptoms, headaches, other vague symptoms that cannot seem to be explained. This test may also be used to monitor whether an illness is responding to treatment. This test can be used to monitor inflammatory diseases or cancer. It is not used to diagnose a specific disorder. Okay, so it says that right here. However, the test is useful for monitoring and detecting autoimmune disorders, bone infections, certain forms of arthritis, inflammatory diseases. Okay, so here's where you get into the results. Mine was 22. So it says for adults, men under 50 years old, theirs need to say less than 15. Women under 50 years old, theirs need to say less than 20 millimeters. Mine is 22. Okay, so it says here, what abnormal results mean. An abnormal ESR may help with a diagnosis, but it does not prove that you have a certain condition. Other tests are almost always needed. such as, or it says an increased ESR rate or SAID rate may also occur in people who have horrible anemia issues, cancers such as lymphoma or multiple myeloma. So this is where when I did another video, I was very, very concerned about what's going on in my spine, and found out that a young man that actually had these same conditions and everything went to a specialist that told him that he had multiple myeloma in his spine. So that's why that was so scary for me, right? It's also to monitor kidney disease. It can also monitor pregnancy and thyroid disease. It says the immune system helps protect the body against harmful substances. An autoimmune disorder is when the immune system is mistakenly attacking and destroying its own healthy body tissues. ESR is often higher than normal in people with an autoimmune disorder. So it's factual that my first autoimmune disorder started with my digestive system in my stomach, where that gastroenterologist diagnosed me with ulcerative colitis and IBS. Okay, inflammatory bowel syndrome. Okay, a common autoimmune disorder are lupus, polymyalgia rheumatica, rheumatoid arthritis in adults and children. So we get there, right? Very high ESR levels occur with less common autoimmune disorders, such as allergic vasculitis, giant cell arteritis, hyperfibrinogenemia, hyperfibrinogenemia, which is an increased fibrinogen levels in the blood. And I think she did check for that as well, fibrinogen. I think that was also tested. Okay? Right? Macroglobulinemia primary and necrotizing vasculitis. An increased ESR rate may be due to some infections, including body-wide systemic infection, bone infections, infections of the heart or the heart valves, rheumatic fever, severe skin infections such as erysipelas and tuberculosis. Lower than normal levels occur with people who are having congestive heart failure. Okay. Hyperviscosity, hypofibrinogenemia, which is decreased fibrinogen levels. Leukemia, low plasma protein due to liver or kidney disease. Polycythemia and sickle cell anemia. So this test is very, very, very important, is my point that I'm making. So mine was 22. So let's know what it means. Okay. Let's know what it means when it's high. So it's showing here that the other thing that was tested was my cyclic citrullonated peptide, or CCP ABIgG. Okay? Now, when I got this tested with the first time with Harris Health, it was 55. It was 55. Of course, they use a different lab, right? With this lab company, Quest Diagnostics, is showing as 35. Okay? So it's saying that a high CCP is consistent with rheumatoid arthritis in a patient with polyarthritis. A positive anti-CCP result is frequently found in patients with early rheumatoid arthritis and may be associated with progression of joint destruction. Okay, so that's what Dr. Mehill is going to be looking at now, you know, when she gets around to doing it. And I've already emailed her and asked how do I send her my x-rays of my spine that she asked me to do. Okay, do I need to fill out a form? Okay. So my hemoglobin A1C is showing up again right here. That was high. Okay, so we already said that. All right. Now, what was great that I couldn't get them to give me a clear understanding of what was this hepatitis B surface antigen. But it's clear here that how Quest talks about it is non-reactive. So it says, you know, it's non-reactive. So that means that, you know, I don't have hepatitis B. Okay. I don't have hepatitis. Okay. That's what that means. All right. You know, everything's looking within normal levels in my platelet count, my neutrophils, lymphocytes, all that good stuff that need to be right, which showed me negative things in their results. And I was like, what the hell's going on? My C-reactive protein, I know that has to do with my kidney functioning because of the ex-husband's records and stuff. And that always was way off with his kidney malfunction. Okay. So here it goes. It says also hepatitis C. It says HCV antibody was non-reactive. Okay. So there's no laboratory evidence of a hepatitis B or C infection. It's negative. All right. Okay. And I was just watching the Unsung with 807. Was that they name? 807. And how her sister died of hepatitis, autoimmune disease, hepatitis, something like that. So that's why it's jumping at me. So that's what it's saying right here in my labs, y'all. So my point is that I knew that it was way damn deeper than some damn Shodrins only, you know, and telling me to take something for my mouth being dry and, you know, do some eye drops, go check for the nephrologist. And then the Centers of Rheumatology Centers of Houston had the audacity to send me a bill for $35 to my no-show. It ain't no no-show. What the hell? I have never set up a new appointment with you. All the back and the forth and they're just leaving me hanging and what the fuck? Like, now I'm telling you, this shit that's been going on, y'all. That's why I put out these videos, to let it be known, you know, for anyone else. And this is why they really fucking with my social medias on all accounts. I ain't gonna get even into this video about what's going on behind the scenes right now with my social medias. I'll leave that for another goddamn day. I want to stay on task. Okay. So my point to say all of that is I decided to go ahead and start taking my prednisone. This is my prednisone. I decided to start taking my prednisone as of 11/17. And so I already did my 4 pills. The first day you got to take 4 pills. And now I'm finna take my second day of 4 pills. So we got 3 days of 4 pills, 3 days of 3 pills, 3 days of 2 pills, 3 days of 1 pill a day. And this shit is nasty. Okay? Nasty. Okay? Did I say it many times? Enough emphasis? Nasty. So that's why I did the talking I was doing before I take my meds and try to wash it down with some of this. I know it's not good for your sodas and stuff, but I'm telling you, I had some juice. That didn't work. It stayed on my tongue for a long time, so I don't know how else to put it in my mouth and take it without it being on my tongue. I don't see, was that all I want to talk about? So now I'm waiting to communicate with my rheumatologist to get more of a definitive of what's going on, right? So, you know, I've been knowing it. I've been doing it, seeing my joints and the swelling and the puffiness. So anyway, let's talk about prednisone, okay? Let's talk about prednisone. So it says on here, this is a steroid to help with all the symptoms I'm feeling of the swelling of the joints, the inflamed, all of that, the pain, all of that, right? Prednisone. So I was also given hydroxychloroquine to take for lupus as well as rheumatoid arthritis. So Dr. Mihu said it takes a very long time to get in your system to start working. So I'm not going to start this one because I want to see how my prednisone is affecting me. So we did 1 night of it already. I felt no, like, ongoing, like, ooh, I didn't feel this till I took that pill. Because I have the type of bloodstream that's extremely sensitive. Meaning, like, I will catch every damn symptom, a side effect, along with new shit. My bloodstream is extremely sensitive. So let's go ahead and take these next 4. They nasty as hell, I'm telling you. And it's 3 little bitty ass pills. And they nasty as hell. So the way I did it yesterday is I put all of them in my damn mouth and got it down. I did take it with water. I absolutely abhor taking pills. Hated it. So I got my 4 pills down. And what time is it? 7:16. So I did the other one yesterday at 8. As long as I get it done, because I don't eat all day, y'all. And when I finally do eat, because I threw up this morning. Okay, so for the record, I threw up this morning and it came out of nowhere. Like, I didn't start having dry heaves or anything like that. I was brushing my teeth, and I go to brush my tongue, and I just start hurling up everything that I did get to eat. And so that means it didn't digest at all. So I threw up and, you know, cleansed my mouth and everything like that. So I don't be eating till around this time because, you know, I just don't feel good. I'm constantly nauseous and headaches. Oh my God, the headaches. And then the muscular pain, the nerve pain. I'm in so much pain. Like right now I'm having this very like weird ass pain around my belly button. Like, what is going on with this pain? Like, oh my gosh. And not to mention, as a woman of 49 years of age, I'm still having my menstrual cycle. So my rheumatologist was saying to me that yes, when your cycle is about to start, your symptoms can worsen. And I'm telling her, like, I'd be just ready to just you know, go to the upper room because it'd be too much. I never had these problems when I was a younger woman or before I got this condition, right? I never, you know, I would get my menstrual and have breast tenderness and, you know, just the normal stuff that we women get of a mild form, you know. But now it's like I mean, oh my goodness. So, you know, my headaches have been out of control and my joints, child, like everything I feel be a million times more intense when my menstruation is getting close. And that's what I love about Dr. Me, who actually confirmed that, yes, that's true. So at the end of me taking the prednisone, it would be, I mean, by when I'm done taking the prednisone, that last day would be November the 27th. So I decided to allow my body to get acclimated, and I'm not taking on any hemp, anything like that, because I don't want to mix stuff. Okay, and it do help me with my anxiety, my nervousness, my inability to have any appetite whatsoever. It does help me, and it's legal. So I always keep my papers with me. All right, okay. And so here's the thing: I have to wait for her to say, give me another definitive. But what I did like is how when she wrote it up as the following list includes any diagnosis that were discussed at your visit. So she put Sjogren's syndrome. So because of this Sjogren's syndrome, you know, is when she started writing up everything. Now, one thing about it is that she also prescribed me a 50 milligram tablet of tramadol. And then I realized that it was saying you should not take the tramadol. Was it with the hydroxychloroquine? Something I read, because I read up on everything that I'm given. I don't just pop no pill because the doctor said, I'm finna give you this. And that's what I liked about Dr. Mihu, that she didn't come off like, I'm gonna write you these prescriptions, you take this medicine, I'm gonna see you in 6 weeks. She asked about supplements. She asked me, what about turmeric? What, you know? So that's what I really loved about her. And then I came, you know, the Most High God, my spirit team, allowed another doctor to come up on my news feed for YouTube, who is a rheumatologist who actually went through a horrible long stint of rheumatic disorder or something going on autoimmune in his system. So he suffered for a long time to get his health together. Even though his father is a doctor, he was studying to be a doctor as an actual human being that walked the walk. Now he's talking about nutrition to help. So I'm really on this path of healing.